the issue here is that we now have, from several clinical trials, etc., efficacious treatments to prevent or delay the onset of complications. And so if people are undiagnosed, then it means they have a higher risk of developing these complications because they aren't found early, and they aren't treated early so that they can derive the benefit from the treatments that we know early. And so these people are at high risk of having early onset of the same complications that people with diagnosed diabetes. It's not a different disease because it's undiagnosed. But the earlier you find it, the earlier you start the treatment, and of course, the extent to which you adhere to the treatment, follow the treatment, then the person's prospects for their health, right, are much better. So that's why we're concerned by the undiagnosed. And the first thing that people are much more aware of the disease now. So an important cause of increasing rates of anything is increased awareness about the problem. The increased rate at which the problem is detected or ascertained, the increased level at which it's documented. So when you come to count cases, there are more death certificates with diabetes on them, right? So that's a very important thing to understand. And also there's a lag time between development of the disease and the time to die from it or with it. One of the benefits we got from the study was a very high response rate. Over 90% of the people participated, at least gave us even if they didn't want to have their blood taken, but at least they let us measure their blood pressures and they answered all the questions from which is very unusual in studies in first world countries, by and large. The response rates are rather low, to think of it. So that was one thing. The other thing is I think that I learned, or my knowledge was confirmed, is that the high quality of talent, survey talent, epidemiologists, statisticians, etc., in both countries, because Mexico City was extremely helpful. They provided us with highly skilled staff to help us in the sampling design, the survey design, and like I met some fascinating people that I learned to respect and like a lot. But I think the thing that I came away with is that we can do this if we have the will enough to do it. We had to use different types of approaches than one might do if you're sitting in a university someplace, and I've had that experience. But we were determined to do it, and the people were very cooperative. The population itself, the healthcare workers, the press. So we got it done. And for me, that's the